Hello everyone, welcome again to my channel. I am Dr. Zina. Today we'll be talking about the different types of tooth fractures together with the causes and treatment. But before we continue, make sure to hit the subscribe button down below for more videos. The first type of tooth fracture is referred to as fractured cusp, which occurs on the biting surface of the tooth and tooth filling, and there's no pain from it because it does not involve the pulp. But since it is fractured, of course, sensitivity might take place. Here is a picture showing the patient is having a fractured cusp. This fractured cusp, it is not deep enough that it is reaching the pulp, so no pain from it, but sensitivity, of course, will take place. The second type is cracked tooth. Now, the cracked tooth, if it extends to the gum line, then extraction is required. Here is a picture showing a cracked tooth that is cracked in the middle. As you can see in the picture, this is a cracked tooth. In this picture, it is reaching the gum line. So if it is reaching the gum line, then of course, in this case, the only treatment will be extraction for the tooth. So it is hopeless. It's considered to be hopeless. Another type of fracture is split tooth. If the crack travels below the gum line and is left untreated, then it will lead to split tooth. And this split tooth, it will lead to a complete fracture of the tooth. Even you will not extract it because already it will be broken into fragments because it's referred to as split tooth. As you can see in the picture, this is split tooth because the fracture, it is more extensive than the cracked tooth. And here, if the cracked tooth left untreated, this will result in split tooth. And in this case, split tooth, as you can see, there's bleeding, all is taking place. So in this case, extraction, of course, is the treatment as well because it is hopeless as well. So these are the differences between the three types of fractures that we spoke about. We have fractured cusp, which is very simple, and the treatment is just to cover up the fractured area with a composite, or you can do a crown for the patient as well. Another thing, we have cracked tooth. For the cracked tooth, if it does not extend to the gum line, then we can protect the tooth from damage or from further damage or from proceeding to becoming split tooth by covering up the tooth with a crown. And lastly, we have if the cracked tooth, if it extends up to the gum line, then and left untreated, this will result in split tooth and extraction is required. Lastly, we have is vertical root fracture. It is a fracture below the gum line as well. And here also extraction is indicated. Always, if the fracture is extending below the gum line, the only treatment in this case is extraction. You cannot save the tooth. So how can you diagnose a patient if he is having vertical root fracture? By seeing the periapical x-ray if there is any radiolucency in the periapical area. So a radiolucent halo on the periapical area of the both roots, this is indication that the patient is having a vertical root fracture. But of course, you cannot confirm your diagnosis with a periapical only. What you need to do is, the only way to confirm a fracture is via transillumination, or you can take CBCT. But otherwise, if you don't want to take CBCT, you can confirm it via transillumination. You need to take a transilluminator light in order to see if there is any fracture or no. Here is a picture showing a transilluminator light has been used, and you can see the fracture line. And here the fracture line, as you can see, it is extending beyond the gum line. Or you can confirm whether it is beyond the gum line, of course, by the parapical X-ray. It will be extending beyond the gum line, and if it is extending, then the only treatment will be extraction. And in some cases, it depends. Maybe extraction, maybe you can save the tooth by crowning. So now, what are the causes behind all these different types of fractures? Number one is excessive tooth grinding, which means that you are exerting too much force on the cusp or on your teeth, which will result in fracture. Another thing, if we have a weakened tooth structure. Another thing is chewing hard substance, giving excess stress to your teeth, and large fillings that may weaken the tooth structure. Any of these causes might lead to a fracture of the tooth. Now, in addition to the diagnosis that we spoke about, also we can diagnose it by the symptoms of your patient. So always if the patient is having pain on biting, tooth sensitivity, random pain, swelling gums, these are all symptoms of fracture of the tooth. And in order to confirm your diagnosis, as I said previously, via transillumination. Transillumination. If not transillumination, you can use CBCT in order to confirm your diagnosis as well. So what is the treatment in this case? Now it depends. If the fracture extends up to the pulp, then we need to do root canal treatment in this case. Like for instance, the vertical root fracture, it can lead to an infection in the pulp. So we need to do root canal treatment followed by crowning of the tooth in order to protect the tooth from the further damage. Not only that, when you are planning to do root canal treatment for patient with a vertical root fracture, once you are done with the emergency access for the patient, you need to reduce the cusp or reduce the cusp in order to reduce the occlusion, in order to reduce the biting forces that is taking place between the upper and the lower teeth. Because as I said previously, if we exert stress on your teeth, then this will result in fracture, tooth fracture. So in order to reduce the stress after the patient is having vertical root fracture, we can reduce it by reducing the occlusion. Reduce the occlusion. We don't want the lower molar and the upper molar to bite on each other. We need to reduce the occlusion in order to reduce the stress. Not